forward to having a brunch with your families, and enjoying coffee and walks around the island, so I appreciate you guys coming in. My name is Jeff Cathy, and I'm a paramedic as well as a fireman. I've been with Newport Beach Fire Department for about 10 years, almost 10 years, 10 years in December. Right there is Dean Rush. He's been a paramedic for about 14 years or so. And Cameron Hudson, he's a captain. He's been with the department for about 15 years or so. And he was a paramedic for about 10. So you've got a lot of experience in there, about 30 years, 34 years of paramedic experience. And so the reason why I tell you that is because you guys can feel comfortable. You can ask us any questions you want. We'll answer you the best of our abilities. With that being said, I would prefer, if it's okay with you guys, to ask the questions towards the end, so that way we can give you the right amount of attention. So I'm not trying to rush through the presentation as much. Now,
Jeff, before we get going, would you mind if I just introduce Mr. Ed Siegel here?
Oh,
he's one of our CERT members. Obviously, today we're going to teach you about layperson CPR and how to use AEDs, but Ed is one of our CERT members. He meets up on a regular basis over at our training center. I don't know if you guys have ever been introduced to CERT before, but he's going to tell you a little bit about it. I know they have a class starting in the next few months, right?
Just the thought was that after you get through today, you have more concerns about it, especially people with mustaches. If you have more questions about what you're doing, how to take care of yourself or the neighborhood in the case of an emergency, twice a year, the fire department offers a CERT training, which goes into much more depth. And the next class, I think the class now is full of, and started the one that's going on now. But there's another one in February. We're actually March, I believe, next spring, and it's I think 12 weeks on Tuesdays and Thursdays or Saturday mornings. And really going to a lot of depth if you want to expand the kind of thing that our name is called.
it's a great program. They actually do two options. You can do is it two weeknights a week for
Tuesday and Thursday,
or you can do a few Saturdays that are full days. So it's really your option. But like he said, it's very much more than what you're getting today. So you're getting search and rescue. You're getting fire extinguishment. You're getting certification in CPR. And so you're dealing with airway obstructions, all that, dealing with CPR with children, all of that. It's a very, very good class, and it's specifically on Balboa Island. There's probably no other community in Newport Beach that needs it more than Balboa Island because of the access getting on the island. So, thank you. All right, so CPR, AED use. Do you guys know what an AED is? Awesome. That makes my job a lot easier. But I'll still talk about it a little bit. The reason why we're doing this class is because last January we had a reduction in staff, and what that did was initially it removed an ambulance from the city, and that directly would affect response times. And that specifically in Balboa Island, where that comes into play is if someone's in cardiac arrest, is it going to be a 6-minute wait, or is it going to be an 8-minute wait, or a 9-minute wait, right? And so what they did to alleviate that is they put an ambulance out front. That's why it's been there for maybe 2 or 3 months now. It's not staffed. Well, actually, it just got staffed 2 weeks ago or last week by a paramedic, so that's good. But where that comes into play is that since that paramedic, if they get dispatched with the captain on that call, that means there's no one on the engine here, there's no one covering the city here. And on top of that, that's getting dispatched, that means the other 3 ambulances that normally cover the city are already on calls. So you guys will not have a fire engine for 45 minutes or so covering the island, as well as maybe an additional 6 to 8 minute wait for a paramedic. So like I said, we wanted to get people out and learning layperson CPR because there's about a 4-minute time frame before brain tissue death. And so if people are not afraid to do compressions, because that literally is worst case scenario, if people are not afraid to do compressions or use the AED, then we can sustain that person's life, because we are not the first responders, police are not the first responders, you guys are the first responders. Because as we'll see here in a little bit, a vast majority of cardiac arrests occur within your house or at somebody's home. So we're going to go right into that. Some of these slides I'm going to kind of skip through because I got kind of a longer presentation. I tried condensing it down to 1 hour, but it wouldn't let me put it on the tablet for whatever reason. So, let's see here. In the city, there's about 38 firefighters. All the firefighters are either EMTs or paramedics. So what's the difference between an EMT and a paramedic? An EMT does splinting, CPR, bandaging, stuff like that, vital signs. Paramedics do all of that, but they're more at an advanced level. So we're giving drugs, we are shocking the heart, and we are intubating. Intubating, which means that we're putting a tube about this long down their trachea into their lungs to secure an airway so we can force air into the lungs if someone's not breathing. We also do something called the needle thoracostomy, which is where we put a very large needle in somebody's chest to reinflate the lung during a traumatic injury. That would cause a lung collapse. So like I said, average response times are 4 to 6 minutes. So like I said, brain tissue death starts at 4 minutes, right? So best case scenario, you'll have us there within that 4 to 6 minute time frame. But like I said, that's why CERT is so important, is because if you guys go through that class, whether it be a medical aid or a small fire in your backyard or whatever, or a natural disaster where it's something major, you're more comfortable if you've had the training to go through it. It's a really great program. Right here it says over 11,000 calls happened in 2015. I did this study. I looked at the call. It was actually 11,800 and some change. Now, here's something interesting to know about Newport Beach. Since about 2003, Newport Beach call load was growing about 2 to 3% a year. That's about average, right? Normal growth, whatever. But since 2014, we've had a spike of 20%. And it's continued to grow. That is a massive amount of calls. So why are we having this large growth in calls? Well, you see the development that's going on? We've got a lot of development going on. And some people like it, some people don't. We don't care either way. We're here to support whoever's living in Newport Beach and visitors as well. But something to keep in mind. Also, insurance. More people have access to insurance now, right? So more people are calling 911 where before they would just go to their local urgent care and pay cash for some ibuprofen prescription and stuff like that. Dosage, right? You know what I mean? So we're getting a larger number of people calling 911. So why does that go into this? Because the more people are calling 911, we're busier. And so it puts more of the weight on you guys. And worst case scenario is the cardiac arrest. And so we want to fill that gap. So let's see some of these. Okay, this one I want to talk about real quick. This is the map of the city. Each dot is a fire station. So you'll see here the blue dots. Those are your paramedic ambulances. They're staffed with 2 paramedics. Okay. Why that plays an important role is this. I've gone around and other people have gone and did this presentation. Aspects of the city, but ultimately what happens is this happens especially in the summertime quite often. If you have a call in Newport Coast area right up here, Medic 5 is on a call already. Medic 3 is on a call already. Your next transport is coming from Old Town Old City Hall off 32nd Street. From there to Newport Coast is a 20-minute drive. 15 minutes, maybe if traffic is good. That's a long time since a cardiac arrest. The good news is that this station, they anticipated us. They put a paramedic. So the nice thing is they can get there. Dean actually was at that station for a long time. He's gone multiple times where he's been on cardiac arrest where he was the only person there for an extended period. The only person needing him was free. So it takes a long time for us to get there. Oh, thank you. Yeah, that's all we're doing. Those are just the coverage areas of each station. Those are the coverage areas of the 3 paramedic ambulances. Let's skip through things fairly quickly. Okay, let's skip through all that. So, long story short is the fire department is kind of an umbrella term. It's kind of an umbrella term. So we don't just go on fires. The reality is there's not that many fires in Newport Beach. All right, but let's see what else we go on. Gas leaks. People get their kids locked in their car. We go on medical raids. We go on traffic accidents. We go on search and rescues. We go on trench rescues. We go on people digging in the sand and then all of a sudden the sand's collapsed on your kid. We go on a lot of different things. And so the fire department is kind of that umbrella term that to catch all. So out of this slide, the most important thing to get out of this is this. 80% of our incidents have a medical component. There's a difference between a medical aid and a medical component. Okay? The difference is this. A medical component is when someone calls 911 for a gas leak. All right? And you think, well, why don't they call the gas company? That's a natural response. The problem is that when you smell gas, people start panicking and they think, is my house going to catch on fire? It's going to blow up. I've got a water heater over here. It's got a pilot light on it. I don't want there to be a fire. I'm going to call 911. So they call 911. We show up, right? Now that person says, you know what? The smell of that natural gas is making me really nauseous. That gas leak now became a medical aid. Does that make sense? So there's a medical component attached to it. So, like I said, I tell you that because that kind of describes why we're so busy. And 145 of the medical aids that we go on are cardiac arrests as of 2015. Now, out of those cardiac arrests, let's see here, what's in this next slide? It's not. I'll just talk about this one instead. What we're going over today with layperson CPR, it's not for children. Okay, we can't teach you how to do CPR on an infant. He can. He is an American Heart Association certified instructor, but the city cannot sponsor him. I don't know exactly the reason being, but we are allowed to give out this layperson CPR class without the certification. Mainly because, and Dean, I remember Dean was my partner for several, I don't know, 2 years or so. A long time ago, great experience, but I remember him telling me 7 years ago when we were medic partners down on the other side of the city, saying, American Heart Association just came out and they said that compressions are everything. Not breathing for the people. So when someone falls into cardiac arrest in front of you and you're, lip locking them and plugging their nose and you're breathing for them, and you think that takes priority over compressions, that's not true. Compressions take priority. So for the layperson, they're wanting not only to focus on compressions because it's more important, but also because when it comes to ventilating a patient, which is when you breathe for somebody, there's a level of safety that you have to consider. Okay? Has anyone ever done CPR on anyone? Okay. It's the first time you do it is very scary because you're worried that you're going to do harm on the person. All right? Your heart's going to be racing. You're going to be sweating like crazy. You're really anxious, and you're in this area of ambiguity. All right. Well, when you do compressions and you get past that hurdle, you're going to recognize the fact that two things. Their heart is stopped, so you're not going to do any harm to them that's worse than they already are. All right. And then second, as long as you follow the right steps, which is what we're going to go over today, you've got someone coming, and so you're just extending their life. You're giving them a choice. Not a choice, but a chance. Thank you. All right. Okay, so does everyone understand what cardiac arrest is? Arrest means at rest, so the heart is not beating whatsoever. So if their heart's not beating, they're not breathing. So if someone's laying down and you see their chest rise and fall, that's one of the best ways to determine if someone is not breathing. If you see their chest going up and down, they're breathing. All right. Sometimes there's something called an agonal breath, which means that their heart stopped breathing or stopped beating, but they do this. It's just a single breath, and it may happen once or twice a minute. That is not breathing. Okay, that's not them breathing. That's just an agonal breath. It'll occur every now and again, but you still got to work your way through the chest compressions. All right. We'll talk about that. Okay, so what CPR does is it delivers oxygen that's in your blood. Person stops breathing. The oxygen that's remaining in the blood, all you're doing is just you're circulating that. And when you're doing CPR, it increases the odds of surviving cardiac arrest when you're outside the hospital. Right here is kind of an interesting fact. It can double or triple a victim's chance of survival. Because like I said, you guys are the first responders. The earlier it's done, the better. I've had people in the past that have said that they did compressions on a loved one for 20 minutes before they were in another city, before someone was able to show up. And 20 minutes is a long time, because as you'll see here, when you start working with the mannequins, you're going to get tired after about 30 seconds, right? That's why technique is everything. But we're going to go into that about how you need to rotate chest compressions and all that. So, okay. A third of cardiac arrest victims get CPR from a bystander, right? So for every passing minute without CPR, their chance drops substantially. So, like I said, there's 4 minutes before brain tissue death. If you can start pumping on that heart, you're going to increase that survivability rate. Interesting fact, again, almost 90%. It says 4 out of 5, but it's more at 9 out of 10 is a closer ratio. It's going to happen in your house or somebody else's house. So it doesn't necessarily have to be in your house, but you go to your friend's house, your neighbor's house, your brother's house, and whether it be them or somebody else, the vast majority of them are in somebody's house. I mean, Jude, you've been a paramedic for 15 years, 17 years? Longer? 5 years. How many non-traumatic arrests have you been in not in somebody's house? Not that many, I imagine. I mean, it happens. Like you'll find them at the
24
gym.
years.
Yeah, you'll find them at the gym or the tennis courts here and there, you know. But a vast majority of them are in the house. And to be honest, morning times are one of our busiest times, is because people wake up and they roll over and they find their spouse in cardiac arrest, you know. All right, so this little diagram here is something that the American Heart Association came up with, and it's kind of like a 4-step process. So here we're recognizing who needs CPR, and then the following 3 steps are there to support what's going on. So early access. So a phone. Has anyone ever called 911 before? No? Okay. So when you call 911, do most of you guys use cell phones or do you have a landline? Cell. I do not. I don't have a landline in my house. I use my cell phone. But we're going to talk about the differences between the two. Landlines are excellent to have, FYI, especially in cases of an earthquake. Because rarely do they fail after an earthquake, where cell phones fail if it's like a 2 point.
Just fail, the circuits are big.
Yeah.
That's good to hear that.
Sorry. So when you find somebody and you think that they're unconscious, we got to determine when do you call 911. So if you see an unresponsive, unconscious adult who's not breathing or not breathing normally, it says tap and shout. Okay. I'm not talking like, hey, you know, are you okay? What I do, and I'm okay with you guys doing this too, is take your fist, make it tight, put it in the middle of their chest, and start grinding on it. Okay? You want to cause pain. You're not going to bruise them. Okay? And even if it does bruise a little bit, it's okay. Because at least you know. But you want to inflict pain. Whether you're an EMT, a paramedic, a nurse, a doctor, we all do the same assessment. If someone's unconscious, the first thing we do is we tap on them and say, hey, wake up. See if they're listening to verbal cues, right? Next thing we do is we assess their, it's referred to as assessment of painful stimuli. That's when we'll rub the sternum, we'll pinch the trap. Sometimes we'll take a pen and put it in between the two fingers and squeeze the fingers together. We want to inflict pain. We're not breaking bones or anything like that, but we want to inflict a little bit of pain to see if they go like this. Ugh. So if they're doing this, that means they're alive. All right? There may be something else medically wrong with them, but that's fine. We can address that when we get there. But if they're in cardiac arrest, you got to know when you're going to do compressions and when you're not. Now, I'm not going to teach you to take a pulse. All right? You're basically just going off of, hey, if they're not responding to painful stimulus, then I'm going right into chest compressions. All right? Because there was a couple studies that were done, and they came out and said basically, if they're not responding to painful stimuli, there's a good chance that they are in cardiac arrest, because a lot of times it's intuition based. We know our loved ones, right? We know our husbands, we know our wives, we know our children, we know our parents. And when you walk into their bedroom, or you walk into your dining room or whatever, living room, and they're on the ground and they are just not responding. You don't see them breathing, you have a weird feeling in your stomach, they're probably in cardiac arrest. So rub that chest, inflict that pain, and if they're not wincing, they go right into chest compressions, okay? They said that the harm that you do from chest compressions on somebody that does have a pulse is minimal compared to the harm that you do or rather the harm that is done by not doing compressions. So when you do compressions on somebody, if in the rare case that does happen, but the probability of that happening to each one of us is actually high, of seeing somebody go into cardiac arrest at some point in their life. First time I saw it, I was 13. But the probability of you actually seeing it and doing it is high. So don't be afraid. Check for painful stimulation and then go right into chest compressions. So what happens if you're going to call 911? So if you are by yourself with the person and it's unresponsive, call 911 first, then go into the compressions. Okay? But if someone's with you, have that person call 911. And if there's an AED in the area, like if you live across from a post office, or a library, or a gym, some gyms will carry it too, then have that person run over there and grab the AED while they're calling 911, and you can focus on compressions. But when you call 911, first thing that they're going to ask is, what's the nature of your emergency? They want to know, am I sending a cop or am I sending the paramedics? Or the fire department, rather. Right? So if it's a medical related issue, in this case cardiac arrest would be, it's going to be transferred to Metronet. So when you call 911, if it's a landline, it's going to go directly to Newport Beach PD. And then from there, they're going to route it to Metronet, which is out in Anaheim. That's a dedicated dispatch center that's specifically for Newport Beach Fire Department, as well as Fullerton, Huntington Beach, and Laguna. Is that right, Jude? Laguna's with Metro? And there's like 5 or 6 cities, Anaheim. And so the reason we used to have Newport Beach, our dispatch used to be specifically through police back in the 80s is when it stopped. And the reason being is because when you have a police dispatcher that's doing fire as well as police, if there's a cop that is in a high-speed pursuit or needs backup immediately, and you have a chest pain going out at the same time that someone's having a massive heart attack, the dispatcher is going to give priority over the medical aid to the cop. So they found out that it was better and actually ended up being faster to have Metronet, which is out in Anaheim, to route it to them and they can handle the calls. So when you call 911 on a landline, they'll go directly to Newport Beach Police Department and they route it to Anaheim. If you're on your cell phone, it depends where you are. So if you are near a freeway, it may go to CHP first, and then eventually you'll work your way back to Anaheim or Metronet. Or if you're within the city, what they do is they kind of triangulate where you are with antennas, and then they can, hopefully it'll go to Newport, and then Newport Police Department, then to fire. They're going to ask you a series of questions. Where are you? The reason why they ask you that is this. If you're on a landline, they can immediately figure out where you're at. But if you're on a cell phone, like I said, they use 3 different antennas, and they can get a ballpark of where you're at. That ballpark might be that building, this building, and the building next to us. It's not going to give you a specific place, right? Unless you're in, maybe Newport Coast and some of the larger lots. But if you're in an area where you have like 2 acres of land or more, the cell phone, them triangulating is a little more accurate. But around here, when you have houses so close together, they want to know an address. They'll ask you for your address. They'll ask you for your phone number. The reason why they ask you for your phone number is because when you get off the phone with them, and by the way, never hang up on the dispatcher until they say it's okay to. Is because a lot of times when we're going to your house, we have questions. So maybe it's a house that we go to on a regular basis, or maybe it's a house that we've never been to, and you're busy doing compressions, but the door's locked, but there's a key up front that you hide, underneath the garden hose or something. Well, we may call, or we may talk on the radio, maybe Metronet, Newport Medic 63. Is there anything that we need to know about getting access inside the house? Well, they'll say, stand by, let me call the person calling in. So they'll call you guys, they'll ring your phone number, and you guys can answer whatever question they have for you. Medical questions, if CPR hasn't been started, they will actually instruct you over the phone kind of how to do it. The nice thing is about today is that you're actually going to get hands-on, so you're going to be familiar with the process. So them telling you, so if an incident occurs a year and a half from now, them telling you over the phone, like, oh yeah, that's right, I do it this way. It'll kind of refresh your memory. We talked about that. Okay, so we're going right into CPR. So first thing you do is tap and shout. You can do a circle or whatever you need to do. Identify yourself as someone that knows CPR and ask permission before touching them, especially if it's a stranger. To give you an example, on the 4th of July, I went on a medic lay, came as a cardiac arrest down at the beach, and we all know the beach is very busy on the 4th of July. And there's this massive crowd. It was down over off of 52nd Street, right on the boardwalk. There's this massive crowd around this gentleman, and I walk up and I had a paramedic student with me. And he starts going right into doing CPR, and I'm looking at the guy, I'm like, that guy is breathing. And it was just an intoxicated homeless person that was just taking a nap. And so, my paramedic student was sweating because this was like his first CPR, So he was all amped to do compressions and give drugs and shock the heart and stuff. But long story short is, tap, shout, and make sure the person is, completely unresponsive. So, now if they are unresponsive, there's something called implied consent. Now, what that means is this. If someone is unresponsive and you do compressions on them and they come to, well, let's say you broke a rib, and they say, you know what, Joe Smith, I'm going to sue him for causing me chest pain. Even though his compressions help save my life, I'm going to sue him because he's got a lot of money. Well, actually, that Joe Smith is protected under Good Samaritan law. Because what that's saying is that if you see something medically wrong, you as the layperson are not liable for pulling them out of that burning vehicle or doing compressions on somebody that's unresponsive, even if there is some harm that is done to them. Okay? So you're free of liability is what I'm saying. Did you guys wonder about that? Yeah. Because that's normally a common question. Yeah. It's normally a common question. Now, like I said, I don't know if anyone has ever been through litigation before, but anybody can sue anybody. But normally when this was presented to a judge will immediately dismiss it. So you guys are free and clear. All right, but like I said, you're free and fair doing stuff that you've gone over today. But if you're trying to do like cardiac surgery on somebody on the side of the freeway, that's a different story. All right, so we have these wonderful mannequins here. This is the head. It doesn't really look like the head. And this is the chest. So I'm going to have you put your hands, the palm of your hand, whatever your dominant hand is, right in the center of the sternum. Right? The sternum is this piece of bone that basically through cartilage connects both rib cages together, right? And before they used to say mid-nipple line, but that really depends on the person. So mainly just do mid-sternum, okay? You're going to lock your hands like that, and keep your arms straight, and you got to get right up on top of them. Your arms are not going to be bent, because you can be Michael Phelps, all right? If you have poor technique, you're going to be tired either way, first and foremost. But if you have poor technique, you're going to be tired at an exponential rate. I mean, you'll be done in 20 seconds, you know? And whether it's us as paramedics who've done compressions countless times, or whether it's someone doing it for the first time, your quality of CPR will actually, we have a computer that tests compression, the depth and the efficiency and all that. We have this program that shows, even for us, that if you don't switch people out about every 2 minutes, your quality actually immediately starts declining because you're getting tired. So if a family member's there with you, have them jump into CPR and switch out with you so you can take a break. And then 2 minutes later, you can get back in there and they can take a break until we show up. So you're going to get right up on top of them, lock your arms, and for an adult, which is what we're doing, adults and teens, right? You're going to go 2 inches deep, and you're going to do it fast, all right? The rate is at least 100 times per minute. Holy smokes, Jeff, that's 3 digits. How am I supposed to be counting 3-digit numbers in 60 seconds and focusing on doing this? Well, you don't have to. Just, I know have you guys heard the song before? You know what I'm talking about? Staying Alive? Okay, you guys know the song. I didn't make a song up. I would have chosen a more modern song personally, but you lock your hands and you go, staying alive, staying alive. That's how fast you're going. And you want to get good, deep compressions, but the most important thing to recognize is that the heart is a balloon. So every time you're pushing that balloon and collapsing that balloon and squeezing all that blood out, you got to let it reinflate. So we have adrenaline going, and we're just trying to do as many compressions as possible. What happens is you're not letting that balloon reinflate. So you're actually not pumping nearly as much blood out as you should be. So when you start going, come all the way up and then go right into it. All 3 of these guys here that are going to help you have been medics for a very long time. And so we can show you guys how to do it comfortably and go from there. Dean, did you have any success with AED?
Yeah, well, there you go.
Okay, is it this one here?
Yeah.
Do you mind doing it on this one here, and then that way they can kind of run through the motions of an AED? So an AED. Okay, an AED, which Cameron here is going to go through here in a second. You're going to find it at your public buildings, all right? You're going to find it at your shopping malls, your post office, your libraries, and some private community or private businesses as well. Tennis areas. You'll have it at gyms. I had a cardiac arrest. Actually, it came in as did come in as a cardiac arrest on the tennis courts right over here off Jamboree, and they used the AED, shocked him twice before we got there. And when we got there, he was alive and talking. Now, this is the funny thing about an AED. First thing and foremost, don't be afraid to use it. It literally walks you through every single step because it's designed for the layperson. It tells you all you got to know how to do is push the on button. After that, it literally tells you everything. It tells you to remove the clothes. It tells you when to touch the patient, when to do compressions. It'll even give you a compression rate tone. So you can, if you are wondering, am I going too slow or too fast? It'll set a tone where it's like beep, 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 and you can do the compressions with the tone. And then it'll tell you when it needs to analyze. So it'll say, analyzing patient, do not touch patient. When it's doing that, it's reading the electrical rhythm of the heart. Because for an unconscious patient, if it needs a shock, anyone ever see the show ER? Okay, so somebody's flatline, what are we gonna do? We're gonna rub the paddles together, we're gonna slap them on the side of the chest, and we're gonna go yell clear, and then we're gonna shock them. We're gonna go, you know, whatever, the chest bounced off the bed or whatever. Well, guess what? That's Hollywood. We don't shock flatline patients, all right? We give drugs and we do CPR, and through those drugs, we hopefully get them to a point where they need, or they get to a point where they're in a shockable rhythm. And then from there, we'll shock them to a regular rhythm, which is what you guys are in now. So if you're doing compressions and it says no shock advised, don't think, oh my gosh, am I doing compressions on somebody who's alive? It's probably because they're in that flatline rhythm, and more than ever, those compressions are important, more than ever, because that's sustaining life until we can get those drugs on board. Let's see here. Oh, one other thing about AED. Okay, so does anybody have a pool at their house? No? Okay, well, let's say, you know, you just watered your lawn and somebody falls unconscious in your wet lawn. AEDs are giving electricity. Electricity does not mix well with water. So if they are wet, dry them off as much as you can. And then put the AED pads on. Okay, so if you're pulling them from a pool, or if somebody's pulled them out of a pool for you, or if they're coming out of the water, and they're just laying on the sand, just take a dry towel or shirt, just rub their chest real quick. If they're on the sand, that's fine. Dry their chest real quick, and then slap that AED on. And it'll show you exactly where to put those pads. And there. Cameron, did you want to go through? Oh, it's back there. It's like this. Hey, Cameron, did you want to go through the AED?
Yeah, sure.
Of course.
Okay. Bring it up so everyone to see.
Yeah.
So what we have here, it's going to be our mannequin. Obviously, we're going to have our locations of where we put the pads. And then we have the AED. Now, I know there's a couple different brands out there, but really, we're going to show you a very generic brand. They all, like Jeff was saying, they're all very self-explanatory. Some of them, you don't even have to push that initial button to get you going. The moment you unzip and you open this thing up, it'll automatically turn on. So they're very, very easy to use. But I'm going to try to follow the slideshow, which I haven't personally looked at much, so kind of going along the way. But all we're going to do is we're going to open this thing up, and for the most part, what you're going to see here is the actual AED itself and the pads, which are tucked in right here. This is going to be a train AED, so it's going to be a little different than what you guys are normally accustomed to. You might see when you open up your AED. Some of your AEDs you might open up might have some gauze pads or some scissors to help cut off the clothes. The gauze pads will be to dry the patient off. Like Jeff was saying, if you catch somebody who's just, maybe it's raining, or you might, it doesn't rain out here, so or somebody who's in the pool or the beach, you want to make sure you dry them off. You're also going to find razors in here probably to shave the hair off the patient's chest, because you really want to have a good, solid contact with the pads you're going to be applying to the patient's chest. So, but anyways, as you open this thing up, you kind of pull out the equipment you're going to be needing. And for this particular model, we're going to go ahead and just push the green button, the on-off button.
Plug in training pads connected.
So again, this is a training AED, but you're going to hear a lot of similar prompts. So we're going to go ahead and plug in the pads connector, which is right here.
Connector insert. Training. Press the flashing loop.
Okay. So then it's going to
Close from patient's chest.
It's going right to this prompt. Remove clothes from the patient's chest. So that's where this scissor will come into place.
Chest is there. Open gray plastic case and peel off white adhesive pads.
Okay. It's telling me to open this gray plastic case and pull off.
Look carefully at the pictures on the white adhesive pads.
pretty detailed instructions.
Place pad exactly at shown.
So this pad right here, it actually shows me it's going to be going on the left axilla area, the left flank. So I'm going to go ahead and place that right there.
When the first
The other pad.
is placed, peel the second pad. Place pad
Very detailed.
exactly at shown.
I've got a six-pack right now. Yes, you do.
Press firmly to clear skin.
This one's going to be up here by the right clavicle area. Place it right over there. Make sure these pads do tell you specifically where they're supposed to be placed. If you reverse them, you might have some issues with the conduction of the electricity coming through. So make sure these are in the right place.
Completely inserted.
Nice and solid on that bare surface, that bare dry surface. So you wipe it dry, you shake it down.
That both pads are removed from the case. Place pads exactly as shown. Pads must not be touching clothing or each other.
Okay, should be on there. Working.
Press pads firmly to patient's bare skin.
We're going to fast forward to the next one. Hold on 1 second. You might grab an AED. You might
Be sure the pad connector is completely inserted.
It's just not going beyond that process.
Make sure that both pads are removed from the case. Place pads exactly as shown. Pads must plug in training pad connector.
Yeah. We'll do the same thing with the other AED.
Plug in training pad connector.
Plug in that connector.
Plug in training pad connector. Press the flashing blue button to choose training scenario. Remove clothes from patient's chest. Plug in training pad connector. Peel right pad from gray plastic.
All right, now we're back in that same position.
Stay clear of patient.
So now once you place those pads, it already knows where the pads are.
Pad connector clear of patient.
And it's saying that it's analyzing the patient's rhythm.
Shock advised. Stay clear of patient.
For this scenario, it's saying that the shock is advised.
Now.
The only other major button right there is going to be the orange button.
Shock now.
You want to make sure that when you push this button that you're clear of the patient. Everybody that's on the scene is clear of the patient. And you're not standing in a puddle of water. This is going to be delivering about 150 joules of electricity. So go ahead
Shock delivered. Be sure emergency medical services.
and jump on the table.
It is safe to touch the patient. Begin CPR.
So it's telling you exactly.
Press the flashing blue button.
It delivered the shock, and then it tells you now you're safe to do CPR. And it even goes as far as telling you how to do CPR. If you push this blue button,
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time.
See, I told you about that tone? It literally walks you through the entire process. So there's that relief of anxiety, the unknown, am I doing this right? Am I hurt them? Well, like I said, this is not going to hurt the person. All right? It only shocks the shockable rhythm. It's not going to shock them if they're in a normal rhythm like you and I are in right now. It's not going to shock them if they're flatlined. All right? And there's a wide variety of heart rhythms out there where that won't do too much, and that's where a paramedic comes into play. But specifically, this is designed for a person that's in either VFib or VTAC. Right? That is your cardiac arrest patient that needs a shock, a defibrillation. So what we'll do next is, if you guys want to stand up and just find a table, we're going to do some hands-on on doing some chest compressions, and then we'll
put the AED outside.
Okay, yeah, we'll put the AED outside. So if you guys want to do some compressions first, or start with AED first, whatever you guys want to do. Yeah, if there's some bridesmaids, so they always say, he actually comes up, trying to deliver those back to those ventilators. Trying to see this compression is for about a minute. Yeah, it's not working, so you're using compression. If you do, perfect. So we got good compression outside, good position, and you're allowing your partner to get outside of each other. So it's not so bad. Yeah, it's a lot of the side, fine, or something. Rib cage, good compression, somebody that's hands on the side. It's
They stay interlocked, but you know when it oxygenates the infused system already, and chances to increase. And also, you have cardiac tissue death, but you also have brain death.
Yeah, that's exactly right. So you don't have to.
I'm
You get it.
I'm a
You
flight
guys up.
attendant. I don't mess around.
Oh, all right. Yeah, you
I
know.
go through the whole drill.
Okay.
She's kind of blind.